Hello, everyone. Welcome to the NTI Pod Talk. My name is Dianne Kaler, and I'm the Director of Nutrition Therapy Institute. This Pod Talk is our opportunity to have fun conversations with interesting people who have interesting things to say about nutrition, food, and health. I talk to NTI instructors, students and grads, to health industry professionals, to farmers, and anyone else who has an interest in nutritional wellness. While many of our listeners come from within the NTI community as students and grads, we also have prospective students who tune in. And to those listeners in particular, I hope you find that the people we talk to inspire you to finally make the jump to pursue your passion and come to school here at NTI. So without further ado, let's get on with the show. Hello, everybody. Welcome back for another edition of the NTI Pod Talk. I am pleased today to have on speaking with me Dr. Glen Harrison, and he is the owner and founder of the Center of Functional Medicine in Westminster, Colorado. And Dr. Harrison is a chiropractor, but you'll hear that his practice is much bigger than what a typical chiropractor may be doing. So Dr. Harrison, thank you so much for being here. I'm really pleased to have you on the show today.
Thank you for the invite. I'm excited to talk to you. I know our previous conversation, I really enjoyed.
Yeah. I think we're in alignment about a lot of things. So
definitely
should have a good conversation here. So, I always want to hear people's origin story and kind of how you got to be where you're at, and the sparks of interest that led you towards where you're at. So can you talk a little bit about kind of your educational background in terms of health? And I know that you had a previous, really big career before you got into chiropractic. So can you talk a little bit about that and what the transition was to get into chiropractic?
Yeah, well, I'll try to make the journey short. Excuse me. I started off studying exercise and sports science medicine in undergrad, and it didn't stimulate me as much as it should have. But before, while I was studying, I was also working in the mining industry. So I traveled all over the world. I got farther and farther up the ranks. But when I first started, I was a laborer naturally, and I injured myself. And it was a chiropractor that got me back on my feet. Lived in a small town in Canada, 600 people. And I was reluctant to go to a chiropractor. There was only my father that went to a chiropractor, and we thought it was witchcraft. So the rest of the family, so I wasn't going to go. Not until I went through the gauntlet, and I was limping. And without my body, I wasn't able to do my job and pay for my school. So chiropractor got me back on my feet, and I continued working in the mining sector, paying for my undergrad. And I got tired of living out of a suitcase. So figured, okay, I'm going to take the plunge and go back to school and pursue chiropractic because it had such an impact on me. So I did that. And during that process, it was like a second career for me. So it was like a do or die. The pressure was immense. It was horrific. I wasn't sleeping. Diet wasn't the best. Everything else was falling apart. First year in school, when we were learning about blood chemistry or drawing blood, I found out I was a pre-diabetic. That was kind of frightening, but it didn't really matter because I was sleeping 3 to 4 hours a day. Brain fog, digestive issues, depression. It was bad. My whole life was falling apart. And I had an internship, and so I just kept doing what I was doing. Of course, didn't have time for anything else. Everything was time.
Sure.
So the second year in school, I went into, we had to retest our blood because we were still learning. And I didn't want to, but I did, of course. And I was a full-blown type 2 diabetic second year in school. So the consequences of not doing what we need to do. But again, when the wolf is on your heels and you're not sleeping and your mind is in a mess and the world is falling apart, the last thing you have time for, you believe, is health. It'll when school is done, I'll work. It was always kicking the can down the road. At the time, it didn't really, I don't know, I didn't see it was affecting me. And then I had an internship with, we had to bounce around different clinics around the Twin Cities of Minneapolis. And I did an internship with this doctor, and he, of course, practiced chiropractic. That's why I was there. But he also practiced something called functional medicine. I didn't know what it was. I honestly didn't care what it was. It didn't matter to me. I just needed my hours to get through, right? I was literally a train wreck. And I was seeing people come in with, chronic issues and acne and GI issues. And we were getting referrals from Mayo Clinic. It was pretty remarkable practice. And I started to see remarkable changes in the patients. It was bizarre cases. And one thing that the doctor told me, he said, well, Dr. Harrison, if you're going to work in this clinic, you need to fix your health. He didn't even know my health history. He just saw me. He figured it out. Yeah. So I drug my heels, and he kind of led me down the path, and it took time, but I was able to reverse it. I'm not a diabetic or pre-diabetic anymore. And it put me on a path of another stepping stone, going only into functional medicine. So that's how I do what I do.
Yeah. Well, I love that story. And I have a couple questions, if you don't mind. And, feel free to say, not going to talk about that, but can you tell us how old you were when this was going on?
I think I started my doctorate. I think I started my late 20s.
Yeah.
I was an athlete going into school. So it was quite a transition to have that terrible blood. Yeah.
Well, and I was assuming that you were younger, probably younger than 30 at that point. And I think so many people think that, type 2 diabetes, sort of these chronic illness things happen when you get older, right? So first of all, I think it's much more common that younger people are experiencing these things. And I love how you are bringing up the fact that your lack of sleep, your poor diet were showing up as these symptoms. And it wasn't until someone kind of forced you to be able to recognize that. Were you able to recognize that? Because people just, they just still, even though it's so like common sense, the way you live your life, what you eat, your lifestyle habits have an impact on your health. They still tend to not be able to make that direct connection, even when it's in their own body and their own health is so, dramatically compromised.
That's right. I think we're all victim to that.
Yeah.
And I think we need somebody to make that connection for us. We need to have a pain point, but we also need somebody to be able to bridge the gap and make connections. So we have reasoning behind it. The doc that I was working for, it was like, it was either do this or don't work in the clinic. And I was already strapped, like so many people I know that deal with chronic issues. They get behind on life, they get behind on finances, they get behind on their family. They don't have any social life anymore. Tasks are piled up. They're just getting by. And then they have all these health issues. And then they speak to somebody like me or like you and say, well, we got to dig our heels in on this. This is only going to get worse. Well, that's a pretty big pill to swallow, because the plate is full already. Plate is so full that it's overfull. How can we add another layer of work?
That's right. Yeah.
Another layer of focus.
Yeah. Yeah. Well, maybe we can talk a little bit about that a little bit more, but I do have something that I'd like to ask you about. I see on your website that the tagline of your business is correcting the root cause of your symptoms. And I'd like to hear from your perspective, how does this root cause philosophy differ from the conventional medicine paradigm? And how do you bring your patients into that awareness about this root cause philosophy? Because, as we said, like, your symptoms are not just an immediate issue. There are bigger, deeper root cause issues to many symptoms.
Yeah, I think that's a good question. So functional medicine, as you know, or maybe all the listeners, It should be revolving around root cause problems. And that's that's a phrase tossed around in all sorts of different layers of alternative medicine or even conventional medicine. But what does root cause mean? It's kind of digging as deep as you can to the cellular physiology, to never accept this is just cause. Never accept this symptom just cause. But sometimes you can't find the answers, right? Sometimes, like I do the most advanced diagnostic testing, I put it up against anybody, anywhere, right? I put it up against the Mayo Clinic. And functional medicine, we can do that because we're, it's another conversation about insurance, but we can do whatever we need to do. But so root cause is, that's the goal. Go digging as deep as you can and always asking the question, why, and finding those answers, why. And usually there's more than just one why. Like for my case, there's lots of whys, but you have to start on peel the layers off. But how to, maybe the next part of your question, if I'm getting it, there's quite a bit there in the question. How do I inspire, or how do I make that connection, or how do I communicate to the people inquiring? Well, I think in my clinic, I've tried it many different ways, and how to inspire, how to motivate. And what I found that it's impossible for me to run around and start trying to inspire people and tell people to look for the root cause of the issue. Usually what happens is 80% of the people I've worked with, and you know where I'm going with this, they already hit roadblock after roadblock after roadblock after roadblock, where they're on more and more drugs. There's more and more appointments with their providers without answers. And that can be both providers, right? That can be the drug side of the medicine line, or the non-drug side of the medicine line, where they're always going in for musculoskeletal care, always, and there's no history of trauma. Well, what's going on? Well, why do you always need to be adjusted? And that's coming as a chiropractor that I don't practice traditional chiropractic. I refer that out. I don't have time for that. Right. And there's a great place for it. I still have a deep passion for it. Or always going in for acupuncture, always going in for massage. Now, all these things are good. They're all good. But if you go and then your symptom comes back after a week or 5 days, well, is it really getting to the root of the problem? Probably not. And the same thing is in the pharmaceutical side. You go after drug, and then you get other drugs to counteract those symptoms of those drugs. And, I think the average 65-year-old in this country average is in the ballpark of 10 different medications, 7 to 10. It's so
shocking. Yeah.
So the massive polypharmacy, we don't even know the side effects of that. So usually the people that are reaching out to me are already tired. They're already fed up. And then I said something, or I spoke somewhere, or there was some content I had online. They're like, wow, no one's ever told me that before. So then it triggers an opportunity in their mind. There's something else. There's an answer there's a scenario here to this symptom that I haven't been told. And that's how I create that shift. And that it's usually with some form of information, an explanation to their symptoms that they haven't seen before.
Yeah. Helping people make connections in a way that they've never heard before. Yeah. Because, like in your example, which I think, is probably not unique. I think that a lot of people come to the end of their line with their health conditions in very much the same way you did. It would have been very easy for you to just, I assume, go on some sort of medication for type 2 diabetes, metformin, whatever, and never really look at your sleep issues and your diet issues.
Yeah.
And I think that's the beauty of sort of functional medicine, integrative medicine, whatever terminology you want to use for it, holistic approaches, is before you look at that drug as the first option, get to these some more of these root cause issues.
Yeah, dig deeper. It comes with some challenges too, but it comes with rewards that it's the only way you can get them.
Yeah. So sort of in that line of discussion, are there some commonalities of the way I think about them is deal breakers? Like if you don't address this, if you don't put intention into doing this or making this change, your work with me is not going to be successful, or you're not going to achieve whatever goals you have if you don't do this or this handful of things. Are there some commonalities in that?
Yeah, I would say there is really high level, right? Because, for those listening and the people that I see, right? So the patient base that I see, there's a lot of autoimmunity. So we're being very, very customized and unique with the strategy. Everybody has very unique problems, so they need a unique approach. But if we want to say some high level deal breakers, as you use, I like that, that are critical for across, and these aren't new. Okay, so I'll tell the audience, these aren't new magical things, but it doesn't matter what chronic illness you have. There's a couple things. So one thing is sleep. There's nothing that I can fix. There's nothing that a medical provider can fix. There's nothing that musculoskeletal, there's nothing that nutrition can fix if someone's not sleeping. It's impossible. We sleep 25 or 22% less than we did 100 years ago. It is the second most commonly prescribed form of medication in the United States is sleep medication. Number one is pain. Number two is sleep. So, no one's talking about sleep. So nothing can improve. You can't eat enough antioxidant rich foods or antioxidant supplements to compensate for the flood of antioxidants you get with a great sleep.
Yeah.
There's nothing else that can drive growth hormone than a proper sleep. So you just need sleep. So there's one thing that's a for sure. I think if there's another common thing, I would say, so sleep would be a big one. I would say another one is thinking about the next step. So we live in a world with temptations, right? You're in the world of nutrition. So you have these conversations all the time. So someone is hungry. Well, they just, you can click on your phone. You can get any kind of poison come to your door at any time. There's the regulations for the foods. There's an absolute joke. I could rant about that. I know you could as well. So thinking ahead, making a plan, having a strategy of what's going to be ready to eat the next day. You can't wing it. So food preparation is an absolute critical thing. Doesn't matter what. And there's some people I've worked with, I have lots of patients that are nutritionists. There's not too much I can teach them about nutrition. But the vast majority of people, that is another big thing. We have to start thinking about what's ready for tomorrow. So food preparation is another one. I would say those would be two commonalities. I think a third one is we talk polypharmacy, and we always worry about polypharmacy, like everybody's on all these drugs, and there's a place for them. It's great for acute conditions, not chronic. It's a chronic symptom management strategy, at best. So, but not too many people are talking about green pharmacy. We could call it green pharmacy, where everybody's on a mountain of supplements, but they don't know why.
Yeah.
It's temptation, right? It's like, well, I read about this and it's good for this. I'm going to buy that. And so when I'm working with people, intake paperwork has a list of the supplementation, and I've seen an entire sheet of paper where there's one line after another, all these supplements they have. Their pantry is overfull with all these supplements, and they don't know why they're taking them. And a lot of times the supplements are causing problems. So we have to navigate through that. And supplements can be very powerful. We got to be careful with those. I see a lot of problems with supplementation. And the more supplements someone is on, the riskier it is. And we can't just pull the carpet out from under them. We have to slowly wean them off certain ones, because there can be problems. So I think that's another commonality. We have to get down to bare bones, find out where their body is, and then start building them up. I recommend supplementation as well, but it's only based with blood chemistry. There's nothing I prescribe that's not based off at least some objective data. So I would say that's the third one. I would say if there was three, then there's all the other layers, trying to get people active and emotionally grounded, and digestive issues and autoimmune triggers. And, we get into foods. Foods are a big thing. First rule of food is eat real food, whatever that means nowadays. But I see a lot of very unique cases with, again, severe autoimmune disorders. So what could be medicine for one person and their food, and it's not a trigger, an immune irritant, for another person, it's their kryptonite. So I don't have any blanket strategies on foods other than real food, which you talk about every day, I imagine.
Yeah, absolutely. I am so thankful that you talked about the over supplementation thing, because I think, and I am in no way an expert on all functional medicine practitioners, but my sense is that very often when I would say complaints, or maybe that's too strong of a word, that I hear.
No. Yeah, I see. I hear it too.
You go to a functional medicine doctor, and great, you're not put on a bunch of drugs, but now suddenly you're spending, $400 a month on all these supplements, where it gets to be, pages long. And so I think that very often in functional medicine, you can get into this same groove of an allopathic approach using a bunch of supplements rather than using a bunch of pharmaceuticals. That's
exactly right. It's problematic. It's dangerous. It's frustrating. And really what happens is it's like the green pharmacology industry, and a lot of the providers are just replicating what they've criticized from conventional medicine, just in a pill. And pills, supplements, those don't fix root cause. What they do is help nurture and help lift, but there's got to be a reason why you're doing them, not taking it just to take it. And, when I see people come into my office, sometimes they're scared of that. Like you say, there's worry, there should be worry. And then, so when we're working through it, we will use supplementation when necessary. And there can be a lot of it too. And I'll be honest with that. But once they start improving, and once they're on to the top of their game, their blood chemistry is improving, then we start weaning off. Most people, the vast majority of people that I work with, they are on significantly fewer supplements than when they ever came in. They're done. So we use it as a medicine. We increase, and then we start tapering off, and then we're just on the basics, hopefully, and their lifestyle takes over. But it's a fear. It should be a fear. Yeah. What are you going to do with all these vitamins forever? So there has to be a strategy to introduce them, and has to be a strategy, an exit strategy to get out of them. That's very important, I think.
Yeah, absolutely. So, as you know, and all of the listeners know, we are a nutrition school, and my primary focus is that our students learn about the most reliable sources of all of these nutrients that we know have beneficial effects. They are absolutely required for optimal function. And so my goal is to teach and really promote whole foods as your going back to your food is your medicine, right? As your source of those nutrients, rather than trying to figure out, let's take this supplement and this supplement and this supplement, and how do all these supplements interact? If you just know the foods that are the most reliable sources of these nutrients, and figure out a way to incorporate those foods into your diet on a daily, if not, every other day or several times a week basis, the need for supplements then also sort of falls away, because the body knows how to partition those those nutrients from your food, and take up more of what it needs when it needs it, and use it appropriately, because it's incorporated with all the other nutrients that are needed to utilize. There are partnerships and synergisms in the way the body uses nutrients. And so, the thing that I always do is I hear oh, this nutrient, this supplement, so great, so great, so great. And so, the first thing I want to know is, what's the mechanism? How does that nutrient work? What does it do? What biochemical pathways does it play? And then the very next thing I do is I go, well, where can I get that in foods? And I always, and very often it comes down to organ meats. For a lot of things. But, and I just think that using that sort of philosophy and that train of thought can solve a lot of issues with making sure that you're adequately consuming enough nutrients.
Oh, for sure. For sure. Yeah. It's so interesting you say that because, over the years I've seen, this is a funny thing you see, all these top tier nutraceutical companies, like the best of the best, 10 years ago, there was the individual nutrients like vitamin D, which is relative. But that's the way they built supplements. There was like this nutrient, then some other companies, they would have cocktails of certain combined nutrients. But that wasn't that common. But what we're seeing now, like a decade later, a decade and a half later, now we're actually seeing the smart supplement companies, they're coming full circle and they're like, okay, this, I don't know, well, let's an example, let's say iron. Well, iron doesn't come like iron in nature in diet. So, wow, it increased absorption with vitamin C. Why is that? Well, there you go. There's back to the diet where you're going to find where there's iron, there should be some vitamin C. So it comes in the perfect package. So the supplement companies are trying to now mimic what we'd find in food. They're coming full circle. So so food is always the, it's always the goal. It's the way. Right?
Yeah, absolutely. Yeah. I always say, I'm a whole foods nutritionist, and, because I focus first on food, and that's what we teach here. We certainly talk about supplements, and we have a course where people learn about supplements and all the different forms and all that kind of stuff. But I still, I don't know, maybe naively always say that just focus on food as your primary source, and try not to get into all of that.
All the details.
Green pharmacy.
Yeah. And all of the fine little details and get tangled up in all of those.
Yeah.
Like, okay, wow, I'm going to go buy this super organic, absolute everything, and I'm going to make this meal on Sunday. And then the rest of the week is eating out or ordering from the app from the nearest fast food chain.
There you go.
Feel very good about yourself. Pat yourself on the back for one day on that Sunday that you make that really ultimate meal. That's good. There's nothing wrong with that. But what about the rest of the week? You don't necessarily hit 100% every day. Hey, what about 70? What about 70% every day? You're winning.
Yeah.
Hence lifestyle
absolutely.
versus diet, right?
Yeah. That's another huge, really great, thing to think about, observation to think about is it's not just once a day. You have to do it on a daily basis. And
I would say that funnels into another thing that's maybe a game changer is the mindset of looking at, it's an urgent problem. When I see people, it almost always is. They're not moving till it's urgent, just like me. But my urgency wasn't internal, it was external in my health issue. But people have a sense of urgency. So then that naturally they're looking for an urgent strategy. This is where conventional acute medicine has come from.
Yeah.
But conventional medicine it's not designed for chronic care. And the vast majority, what is it, 64? So I think it's 65% of all health related deaths. So, premature deaths in the United States are exclusively due to chronic illness. It's not acute. It's not the heart attacks killing people. It's everything else that's leading to the heart attack. That's what's triggering the heart attack and causing all of these things. So if we can control chronic illness, prevent chronic illness, properly, manage chronic illness, we're going to have much more longevity, but not just longevity. We're actually going to have quality of life. And so back to another game changer, if you will, or deal breaker, is people have to realize that their chronic issue is a chronic problem. They grew out of their health. Now they have to grow back into their health. There's not going to be a fad diet. There's not going to be a fad supplement. There's not going to be a fad exercise routine. because these hyper intense extreme behaviors are not sustainable. And then they fall off. There's shame, there's guilt. Let's wait till New Year's again and let's try this again. And let's go to the gym and then not show up the rest of the year. And then it's just this vicious cycle of spike motivation temporarily, crash, because it's too extreme of a behavior, so they can't keep it up. And then they crash, depression, more gluttony, etc. New Year's come up again, and there's this up and down, and it plays a terrible part of on emotional health. We've seen that over the last few years. Emotional health problems. This just amplifies it. So a very important thing is people realizing that they're in a chronic case. It's going to take time. I don't work with people for years. I don't work with people for weeks. It's usually relatively consistent months where we're doing step by step by step by step. So another thing, people have to remember there's a series of steps to getting back up on the top of their mountain. If they think of it that way, in a series of layers, as we're building them up again, they will be successful.
I love that. Yeah, that is, I've not talked to someone who speaks about it in that way. And that is, you're completely spot on. I love that.
Yeah. And I know you see that. That's the only way we can increase, because what if everybody followed with what really random stuff that they knew? They're like, okay, I got to get exercise every day. I know that. That's not going to cause a health problem. That's probably going to promote my health. I know I got to do that. And I got to eat real food. Okay. But is there a shortcut? Well, the reason is we flip, and suddenly we never got any exercise or even went for a walk once a week. And now we're going to go, and we believe in our mind because we read something. We got to go to the gym every day, and we got to eat super organic, and we got to make this 3-course meal every day and all this. And I'm so far from there. I'm on the standard American diet, and I the farthest I walk is to the fridge, or maybe to my to my connected car garage. That's it. Yeah. Well, that's too far of a jump. They're never going to do that. And then you add chronic illness, like in my world, on top of that, where people have zero energy, zero motivation. They're just beaten down, and a bunch of polypharmacy. So you kind of really got to meet them where they're at and say, we're going to be very consistent with tiny, small steps, not big, random, far apart steps, because that's not sustainable, but nice, slow, gentle little steps. And it's amazing where you can get people. I've had a lot of first appointments where people are on video and they're laying in bed.
Oh, wow.
And they've improved drastically. So got to meet them where they're at, right?
Yeah. And that maybe would be the answer to what we started out talking about. How do you, people are already in a situation where they're challenged. Their health is challenged. They've got brain fog. They've got, autoimmune. They are challenged. And then you ask, they think that they're going to have to add one more thing. How do they add one more thing into their life, their busy life? So that's what you just said.
To be small
would be the answer to that question. Yeah.
That doctor in Minneapolis. Yeah. I could honestly say if it wasn't for him, I wouldn't be here right now. I could honestly say I barely made it through school. Well, my first degree, I barely did because my brain wasn't working. Anxiety, depression, and everything else. But his first rule was, I want you to go for a 15-minute walk every day. And I looked at him. I said, I don't know if I have that time, because academia was so bad. I was sleeping 3 to 4 hours a night. Years. And he said, 15 minutes, is that really going to compromise your productivity with academia at night? Kind of drug my heels. But think of that. That's an insignificant step that most people would say, oh my goodness, that's not going to do anything for me, Dr. Harrison. I said, well, this is how we're starting. But it's still a pain point because they've never done it before, right? But then they do it and they build some confidence, and so these steps, and everybody's step is different depending on their capability. But I like the phrase, we always underestimate what we can, we always overestimate what we can achieve in a day or a week, and underestimate what we can achieve in 6 months or a year. And health is no different.
Yeah. Love that. All right. Well, I would like to hear kind of about your practice. Where are you located? How do you see patients? How can people find out more about you? Tell us about that.
The practice is in Westminster, Colorado. 99% of all my appointments are done remotely. There's only one appointment that I need in the office. It's a physical exam. I have some people fly in for that exam, but then we can work remotely. So that's kind of the practice. A lot of information online. There's the first step to kind of inquiring. We want to make sure that, we can help, make sure that it is a good fit, make sure, because it's a very important thing. Functional medicine requires a relationship because there's the doctor's a guide and a navigator, sometimes a little bit of cheering and definitely some support as they're making these changes. So the first thing, the best way if someone's looking for help is to go on my website. Oh, that's the best place, www.drgharrison.com. And there's a place where you can schedule a free call, 15 minutes. It's not in clinical depth by no means. 15 minutes doesn't do that, but to just make sure that, that I can help. And if I can't, I refer people all the time to other providers where I believe they should be. And then, so that's the best, I guess that's the best way. Go online and you can schedule directly with myself. We can have a call. Okay. That's how I'd recommend it.
And do you have a social media presence? Do you do Instagram, Facebook?
It's kind of random. It's kind of random. We can put the links below, but there's a podcast. I do a podcast with my colleague, and it's called Brainstorming with the Docs, and it's where the tagline is as bridging the barriers between patients and doctors. So we see a big divide between doctors and patients. And so we talk about clinical cases behind the scenes. So if somebody would fall in the category of a patient or someone with a health problem, what do doctors talk about behind the scenes? What is their clinical thought? But we try to use as much layman term as possible so they can kind of, it makes sense to them. And then it makes them feel a little bit more empowered. They're part of a team versus on the sideline. It's the same reason why I usually don't call my patients. I call them clients. Yeah. Because the doctor doesn't. In my world, the doctor doesn't fix you. The doctor guides you. We work as a team. We navigate through it together. I learn from them. They learn from me, and we focus on the finish line. So anyway, there's a podcast, and we release every other week. The YouTube channel. There's quite a bit going on. A lot of information. It's information heavy. That's the way I practice.
Yeah. That's what I'm information heavy as well. And sometimes people tell me too much. So I'm like, are you serious? More is better. But all right. So one other question quickly. You mentioned that you do a lot of testing and so, I assume that you're working with people all over the country, all over the world, potentially. And you're finding that they have easy access to the types of testing that you need them to do, or do they have to come here to do the testing?
No. If they're in the U.S., most of my clients are in the U.S. or Canada. If they're in the U.S., the big lab organizations or even the smaller ones that I use, they can pretty well every state. I think there's only 2 states, Rhode Island and New York, I think, are the only states that have some restrictions on testing. Sometimes across the state line, do their testing there if they're close by. Sure. So there's really no limitation in testing. In Canada, that's a whole nother conversation. Socialized medicine, the doctors will pretty well order anything you want because they're not fighting with an insurance company, which is maybe another episode for another day. But I don't see limitations in testing.
Great. Good. All right. Well, thank you so much for your time today. This was a really fun conversation. And I think our audience is going to enjoy hearing about you and, check out your website. I'm sure they'll all take a look at your website. So thank you so much for your time. I really appreciate it.
Well, thank you. Thank you for the invite.
Yeah. All righty. Bye-bye. Hi there. And thanks for listening today. If what you heard today inspires you to want to pursue an education in holistic nutrition here at Nutrition Therapy Institute, please check us out on our website, ntischool.com, and reach out to us at admissions@ntischool.com. Our in-depth, comprehensive education is sure to provide you with the knowledge and skills you need to create the work of your dreams. Do something that feeds your passion, aligns with your values, and fuels your drive for a vital and meaningful life. It will be rewarding for yourself, your family, and anyone else with whom you interact. And with that, see you on the next episode.